Hi, this is Steve Berlin of Los Lobos. You're listening to WMNF, Tampa, Florida.
The opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
Good morning to you, my dear listener out there in Radio Land, and welcome to the Healthy Steps radio show here on WMNF Tampa, the best darn community-supported radio station and the only community radio station that Ray Batty would ever stream wherever he was. And you can stream the Healthy Steps radio show as well at WMNF.org. Today is Ask Me Anything Monday, and that is a real roll of the dice. The rhythm of the show depends on your questions, comments, and concerns, so let's keep my favorite phone answering megastar Irene busy this morning. Just give us a call at 813-239-9663. That number again is 813-239-9663. You can send an email to dj@wmnf.org. And, as always, you can text us at 813-433-0885. And with that out of the way, back to what we have all gathered here for today in the first place. Ask Me Anything Monday. What have you got to get us started today, Dr. Fred?
Well, good morning, Bill, and all you Healthy Steps listeners.
And back at you, Doc. Have a wonderful day and a wonderful show.
Absolutely. It's going to be a wonderful week, too, I think. This is just such beautiful weather. We are blessed. But you know what? Even with this beautiful weather, there's things to think about as far as health risk. I took a quick trip this weekend, just spontaneously decided to drive down south and went to Captiva Island, because on Captiva Island is one of the most wonderful things, populated fully through the winter season. J.N. Darling National Wildlife Refuge. Ding Darling was a guy that devoted his life to preserving natural Florida, and the Pine Island Sound and the wonderful reserve there is so full of amazing birds. I just needed to get away. But you know what? On the other side of it, on the beach side, on the outside of the islands, there is a massive red tide bloom, thanks to our agricultural and home yard pesticide runoff and everything else that happens with our weird way of dealing with our environment. But otherwise, the birds are looking wonderful, but don't breathe too much around the area, because we have a lot to deal with. The red tide is a terrible risk. It's a neurologic and vascular risk. It's an inflammatory agent. I was wheezing a bit yesterday after the exposure on Saturday. But yeah, pay attention. All you need to do is go online and search for the red tide map from Florida Wildlife, and they will show you a total Florida map with areas where they test. They test every week or several times, and there's nothing happening right now in Pinellas, Hillsborough, Sarasota, Manatee counties. It doesn't seem like there's anything this far north, but just so you're aware. Watch the map, because you don't want to go in the water when there's a neurotoxin like brevetoxin from Karenia brevis, the red tide algae, anywhere around you. So today I wanted to go a little bit deeper. I said this is American Heart Health Month, and I wanted to just give a little bit more data about, what to look for. How do you know you have heart disease? Well, a doctor tells you have a heart attack. That would probably be a really good evidence that you have heart disease. But that's not the only way of knowing. If you have peripheral arterial disease, if doctors would say your circulation is low in your legs, you probably have it in your heart as well, because the vascular system is one organ. Some things you can do to test at your regular, annual physical. Doctors do some basic labs, but they don't dive deep into some of these other concepts. So you'll get a metabolic panel that looks at your sugar and your creatinine, which is a kidney function, and your electrolytes like sodium, potassium, and calcium, and some liver enzymes, but it's not really very specific for anything, but it will show a high sugar if you have that. And the lipid panel, the basic lipid panel that shows you a cholesterol and a triglyceride and an LDL and an HDL cholesterol and a ratio, is really not very modern laboratory value. It is something that we did back in 1975. So there are better ways to look at the lipids now rather than a basic lipid panel, which is what everybody does. And then they go to this ratio thing of HDL to LDL. And really, it's kind of irrelevant when you actually get better data. Because when you look at the particle fractions, so the LDL and the HDL are broken down into particles, and you can look at how many particles there are. And if you have too many LDL particles, even if your LDL number is not bad, you might have risk, because the particles increase your risk. If you have low HDL particles, you might be at risk, because even if your HDL is on the borderline of being pretty good, but if you have low particles, you're less effective with the HDL in protecting your vascular system. And so these are things you might want to look at. Particle numbers change with exercise. So if you get your particle numbers and they're not looking good, and you start a 30-minute-a-day walking program, and you get checked again 6 weeks later, you might notice a significant improvement in particle numbers. You'll have LDL particles go down and HDL particles go up, and you'll have healthier vascular system. But this isn't something that's generally looked at the annual physical. So this is something you might want to ask your doctor to order. Instead of just a basic lipid panel, get me an advanced lipid panel. Both LabCorp and Quest and other companies do it. The advanced lipid panel at Quest adds a test called lipoprotein little a, LPA. And that one is a genetic driver for high LDL. If you have it, you have to work extra hard to keep your LDL low. But it's not alone a risk factor for major events. You need to have other things going on, like a high total cholesterol and high LDL cholesterol. But the LPA drives that going the wrong direction. Boston Heart Laboratories does a really interesting test where they look at the cholesterol balance. What they're looking at is whether your body absorbs more from your diet, from your gut, or whether it makes more in the liver. And there are markers that it can use to look at this metabolism. And so when it looks at it, you can see whether or not you should actually be looking at major dietary changes because you absorb too much cholesterol, or whether you should be looking at doing something to support better liver function, because that's where most of your cholesterol is coming from. These are very helpful tests to manage what's going on. Deeper than that, two additional tests that really help look at whether your vascular system is healthy is uric acid. Uric acid is the chemical that works on gout, but it also can irritate your blood vessel linings and cause major damage. A woman should not have a uric acid level over 5.5 generally if you want to remain healthy, and a man shouldn't be over 6.5. Male uric acid levels are a little bit higher because of higher muscle mass generally. Insulin and hemoglobin A1C are two other markers that would be very important to look at, because insulin resistance drives higher cholesterol. Triglycerides will go up if you have insulin resistance, and then you'll drive the LDL cholesterol up, and then total cholesterol will go up. So those are really important things to look at as well, because if you have the metabolic syndrome, which is a combination of insulin resistance, high blood pressure, high triglycerides, working on high cholesterol, this syndrome is easily fixed with changing your diet and getting rid of some of the carbohydrates and increasing your exercise. Another really important test that I do on every patient is called an omega index. I look at the omega acid balance, the fats. So you look to see if you have omega-3s that are anti-inflammatory versus omega-6s and omega-9s. And the omega-3 index, the omega index is a relativistic measure that helps us understand how much risk you have. So if you have an omega index that's under 4.5, under 5, you're looking at increased risk to vascular disease. If you have a level that's under 8, you're looking at brain risk. So you want a really high omega-3 level to help your brain function well and your vascular system. Images, they can be useful. A basic chest x-ray can tell us whether your heart's big or not. An ultrasound might tell you that, whether the valves are working. But really the biggest cause of cardiac death is cardiovascular disease, heart attacks, strokes. And so a lot of people are getting coronary CAT scans now with a calcium score. I did my first one of those in 2001 when that technology became available. 25 years later, we've moved on to better technology. So if your cardiologist or your doctor's recommending a coronary CT calcium score, defer. Ask them to order an AI analysis of your coronary CT. It's a much better test because the calcium score just tells you where you have scars in your arteries. But the AI test is one that's called Clearly AI, Cleerly AI, analysis of plaque. That can tell us whether you have soft or hard plaque. Soft plaque is the one that ruptures and causes the heart attack. It's important to know that. You can't tell that from a coronary CT calcium score. And so it really helps to look at that. If you have elevated levels, you might want to actually then look at some deeper testing too. Cleveland Heart Labs through Quest offers an amazing test that looks at vascular inflammation, chemicals that are related to the rancidity and inflammation in the plaque in the wall of the artery that leads to the event. And then finally, there's some other testing you could do, treadmill testing, a stress test, treadmill with a tracer where they inject a radioactive dye that watches how the blood flow goes in your heart. That can tell whether there's a functional flow problem in your heart that would risk a heart attack. And then there's also a PET stress scan that looks at it in a different way. But if you're having chest pains, when you exert yourself, that's a sign of unstable angina. And that means you might be at risk for a heart attack. And that would be the time to get all this stuff worked up and figure out what's going on. And, you need to talk to somebody about all these issues. And I'm here to talk with you today. This is the Healthy Steps Show on WMNF Tampa.
Well, let's make it real easy for people to talk with you. If you are just tuning on in, and we're very glad that you are listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. We're inviting you to give us a call at 813-239-9663. Again, that number is 813-239-9663. Irene's waiting to take your call, and she has taken calls from Mary Ann and Peter. Let's go to Mary Ann in Seminole. Good morning, Mary Ann.
Yes, good morning. Can you hear me?
Good morning, I can.
Yes, good morning, Dr. Harvey. I have a question about a supplement called Go-To Cola. Have you ever heard of that?
I have.
Is that any good for anything?
Yeah, Go-To Cola is a plant that has some phytochemicals in it that seem to be beneficial for its antioxidant properties and helping facilitate some of the metabolism in the body. Some people have used it for better brain activity, some for wound healing. In general, I look at plants like this as a very good source of phytochemicals. And so they can be a really good part of any regimen to keep you healthy.
Well, did you have any idea what time of the day to take it, with food or without?
No, not really.
It doesn't matter?
I don't know if it matters. I don't really use Go-To Cola very much. There are so many other things that I do before I ever get to using an herb like that. But they're out there on the market and available for people to try.
Mm-hmm. Okay. Okay, that's all I had today.
Okay. Thanks for calling.
Thank you very much. Bye.
You're very welcome.
That was simple enough, Mary Ann. Thank you for calling on in. And let's go to Peter in Clearwater. Let's get on over. And how are you today, Peter?
Can you hear me?
Hello, Peter. How are you today?
Yes, sir. Fine, thank you. Can you hear me, sir?
Obviously, I'm talking to you.
Okay. My question is, as of lately, I've been experiencing, I guess, a condition called bigeminy, but it's not continuous. It comes and goes. And just a question and some information about it.
So you have a cardiac arrhythmia, an irregular heart rate that's called bigeminy, which means you have two beats going on.
Yes, sir.
And the secondary beat is coming from a site that isn't the normal pacemaker of the heart. And so it's giving the heart a little bit of disruption. I don't know whether you have an atrial or a ventricular bigeminy. There are two different types.
Yes.
Do you know?
I don't know.
Okay, so ventricular bigeminy tends to be more serious. Atrial bigeminy is often a sign that you have some struggles going on with the main pacemaker of the heart. And things that challenge the heart's pacemaker are toxins and lack of oxygen. So two of the major causes for atrial dysrhythmia are alcohol use and sleep apnea.
Okay. I have stopped alcohol many years ago.
Good.
I was taking a lot of omega-3s, and at one point somewhere on the news I saw that omega-3s might cause irregular heartbeat, so I stopped omega-3s.
That's true. Excessive dosing with omega-3 seems to have actually been associated with atrial fibrillation. Don't know why. So yes, if you were having an omega index that was, say, over 12 because you took so much of the omega-3s, right, you might have actually been in a place where the heart wasn't happy with that.
Right.
So has it improved coming off the fish oil?
Yes, it seems to have.
That's the first time I've had anybody specifically describe that. I've seen it written in case reports, but I've never heard anybody talk about it. But yeah, that's an issue. We can get arrhythmia from overdosing on supplements. We can get all kinds of things. So it's really good to have a functional or some sort of medical perspective on what you should be supplementing with and how much.
Yep. Agreed. Yes, sir. All righty.
Well, I'm glad to help.
Thanks.
Have a great day.
All right. Thank you there, Peter. And I do have Daniel in Bradenton on the air. Good morning, Daniel.
Good morning.
Hi there.
Hey, how's it going?
It's going well. How are you, Daniel?
All right. I have another supplement question for you. Have you ever heard of benfotiamine?
Benfotiamine, yes. It is activated thiamine. It is B1.
Synthetic B1?
Yes.
What are your thoughts on that? Do you think it's worth taking? Because it's a little on the pricey side.
Well, if you need some more mental clarity, some focus, possibly, I have been taking some every day. It's actually in my multivitamin in a small amount. I take a multivitamin that has all activated B vitamins in it.
What about for nerve issues?
Yes. Yeah, there's evidence that benfotiamine, methylcobalamin or methyl B12, methylfolic acid, and B6 are all proactive nerve rebuilders. So you can actually reverse neuropathy taking good doses of these B vitamins.
And do you have personally, do you have a daily maximum amount that you should be taking?
Of which?
Of the benfotiamine.
Actually, I've not seen a specific maximum, but I'll have to get back to you on that. I don't really know that there's a specific maximum, but thiamine itself, that one tends to be maxed out at around 100 milligrams. I think you start to get a lot of B vitamin flavor, like you can taste it if you eat too much thiamine. Right. So, but you do need less of benfo, and I think my benfotiamine dose is like 10 milligrams. Let me make sure.
Because I've heard anywhere from 300 to 600 a day.
Yeah, that's for people with medical issues. Quite often, Western medicine tries really high doses of a lot of different things in single in single items. They want to prove that there's a magic bullet. It seems.
Yeah.
And it's really, it doesn't work that way, because I think taking smaller doses of multiple things are more synergistic, because that's the way we eat. We don't eat 8 pounds of broccoli at one sitting, but one capsule of a broccoli extract may have the value of 8 pounds.
Gotcha.
And so I think, watching this over the 30 years that I have, I think there's a lot of Western medicine delusion in integrative medicine, where they're still looking for line item bullets to do one thing for everybody, and it's just not going to be found.
Yeah, gotcha.
My thiamine dose is 20 milligrams, and I do take another 10 milligram benfotiamine besides that.
Okay, sir. I just wanted to get your opinion on that, and thank you, and great show.
You're very welcome. Have a great day.
Yeah, you too.
Okie dokie. We do have Jack, and I want to thank him for being a first-time caller, but I want to encourage other people to be a first-time caller or any other number down the tick line. Give us a call at 813-239-9663 to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. Again, that number is 813-239-9663, or continue to send your emails to dj@wmnf.org. Good morning, Jack. How are you today? And thanks for calling.
Hi, Dr. Harvey.
Hello, Jack. Doing great. How are you today?
I'm trying to turn the radio down. Is that better?
Yes.
I'm so sorry. Rookie mistake. Are you able to hear me?
Yeah, how are you today, Jack?
I'm just fine, sir. I'm a chronic pain patient. I've been on fentanyl patches for 20 plus years. I had a spinal fusion go sideways, so adhesive arachnitis.
Mm-hmm.
And no cure looking out in the future. My question is about peptide. I can't afford a regimen, say Sylvester Stallone's HGH, or although I did do that in 2007 for my last big surgery, and it was really the best that I had felt in 20 years. I'm wondering whether or not you have read, or if you have any experience with the current peptides that are available, quote, for experimentation.
How about peptides that are available for use clinically, like Ozempic? Semaglutide is an amazing peptide.
Yes. I understand. Yes, and there's a lot of people are getting some really great results. Weight loss is not really an area of concern for me. Peptide doesn't exactly give you the munchies.
Sure.
But as far as just overall health and energy, basically like a GHRP sort of precursor, I was just wondering if you had any thoughts on it. Obviously, injecting something that you're not...
I have a question for you. I have a question for you first.
Sure.
Since pain is an inside job, how's your meditation practice?
I'm sorry? Since the pain is an inside job?
How is your meditation practice?
I'm not very consistent, but
okay, there's an issue.
Quite a bit.
If you want to control chronic pain, you have to start working on your consciousness. You have to start a very consistent daily meditation program, because
2 hours a day of laying down with headphones and an audiobook, would that be in the realm of?
No, that's actually listening to an audiobook.
Oh, okay. It's really the only way I seem to be able to get my mind to shut up and
yeah. So there's actually a lot of ways to do meditation when people feel like they get distracted, because everybody gets distracted. Your mind's never going to shut off till you die. So while you're meditating, you have to understand it's going to be talking to you, and you just have to understand that it's going to do that, and you can just pretend like it's just a radio playing in the background, because you don't have to respond to your own mind.
Of course, but over the course of a couple of decades, I've done the behavioral therapies of...
I'm not talking about behavioral therapy. I'm talking about actually meditation on a daily basis, internal personal consciousness work.
I think we could all use more of that.
We all can, absolutely. So there's a guy that actually was in chronic pain. He was a chiropractor, and he was sick of taking opiates. And so about 25 years ago, he dived down deep into internal work. And he figured out how to get his pain controlled and get off pain medications, and now he teaches that to everybody else.
Well, they tried to titrate me down, doctor,
No, I'm not talking about titrating your pain medication. I'm talking about actually committing to doing a daily consciousness work.
I just wanted to throw a number at you. I wound up in the emergency room after the titrating.
Okay, I'm not worried about titrating. I'm not talking about titrating. I'm not talking about your medication. I'm talking about you.
Yes.
And so you need to take the responsibility to actually change your consciousness about your relationship to pain, because that's the way it works.
Okay.
Because right now you have a relationship with fentanyl and pain. If you can change the relationship to pain in you, not pain and fentanyl, then you can figure out how to actually control it. And the person that's done this work, that's actually got out of the pain and teaches other people how to get out of the pain, his name is Dr. Joe Dispenza.
Dispenza?
Yeah, his website is drjoedispenza.com. On there, he has courses that teach about consciousness, teach how it works, and then teach you how to do guided meditations that are like listening to an audiobook, but they're actually listening to directed consciousness work that's intended to get you into a better state of being. How's that sound?
It sounds wonderful, but when your C-reactive protein test comes out...
It's irrelevant because C-reactive protein actually comes down when you do regular meditation. You control your biomarkers of inflammation with your mind.
Well, the nervous system sort of sends the mind a lot of signals, too. I mean,
well, yeah, so that's the whole thing. Yeah, so when you control your consciousness and your mind sends the signals to the nervous system to act differently, then you get pain-free.
Okay. So any original question, have you had any experience with a peptide that helps growth hormone factor?
Actually, I don't think growth hormone's your issue. I think that inflammation is. And semaglutide is an amazing peptide that reduces inflammation and helps people get over pain syndromes, too.
Really? Semaglutide?
Yeah, it's doing amazing things.
I've never seen that once.
It reduces inflammation in the brain and reverses Alzheimer's disease and Parkinson's syndrome.
Oh, all right. I'll be all over my pain doc. I got it. Awesome. Thank you, Dr. Harvey.
But before you dive solely into semaglutide, get on Dr. Joe Dispenza's website, because that's the key.
Absolutely. That's going to be in 15 minutes. I'm going to be in front of the machine gobbling that up.
Fantastic.
And I just want to say that you coming on the air and doing this for the community, you are one of the big reasons that in the last 25 years I've lived here, that I contribute each and every year to WMNF, and I urge anybody listening to do the same. And just imagine that instead of listening to this, they're listening to some robo-programmed issue. So
you are so right, and I thank you. This is one of the best radio stations on the planet, and the information that we get here is just irreplaceable. And I thank you for your support. MNF and the community thanks you for your support. And, we're coming up on our winter fund drive here. So if anybody's thinking about it, stop by the tip jar and get ahead of the curve here for the fund drive. It's coming up next week, I believe.
Absolutely. Long time and every time. So wonderful.
Thank you.
It's a wonderful thing in the community. Thank you. God bless you.
God bless you. Have a great year.
You too. Bye-bye.
And thank you there, Jack. We do appreciate you calling on in. We appreciate you supporting WMNF, and there's nothing more powerful than a first-person testimonial to the value of the Healthy Step Show and WMNF in general. It is a community-supported radio station. Let's go to Judy in Sarasota. Good morning, Judy.
Good morning. Hello.
Hi, Judy.
It's Judy Martin.
How are you today?
I'm good. My question is, I have a stent going back now 6 to 7 years when I had a heart attack, and, did the standard, medical protocol for a year, and then with your help, gradually weaned off the beta blockers and, all of those prescription medications, and covered my bases with supplements, and have been completely stabilized and doing great. However, it's been recommended that I resume going on a baby aspirin, which I'm reluctant to do because I'm afraid of a bleed. My skin is very thin. I have vascular problems. And, I have that purpura, I don't know how you pronounce it, where if I bump myself even slightly, I turn purple.
Yes.
So I'm wondering, I use a supplement, which is a combination of pycnogenol, which is the French maritime pine bark, and nattokinase. And I just wonder, I've always thought from what I've read that substitutes or, would at least do the same kind of function as a baby aspirin. So I just wanted to know your take on that.
Well, after a stent placement, you have an increased risk of another heart attack because the stent makes everything in your artery very irritated, and so a clot could happen right there. So it's imperative for at least a month, if not a year, after a stent, you take an aspirin and a antiplatelet agent. After a year, there seems to be very little evidence that ongoing therapy improves anything and that it increases your risk of a bleed. And so it makes sense to remain off of platelet agents a year after the stent because they don't seem to add anything to your therapy.
So is the platelet, is that nattokinase? Would that be a platelet?
No, nattokinase is an enzyme that actually helps to degrade fibrin, the chemical in blood that makes clots happen and makes blood stickier. And so nattokinase makes the blood less sticky, but it's not an antiplatelet agent. Aspirin and then the medications, Plavix and other ones like Plavix, clopidogrel, are the antiplatelet agents that are referred to in literature.
Okay, now I did keep on all those things for a year, maybe even a little longer.
Yes.
And once I was stabilized, as I said, then I weaned off one at a time, not all at once. And, so what I'm wondering now, I mean, it's been 7 years since I had this heart attack. I've been stable, but I had an additional problem. I had an AV heart block, and I did have a micro pacemaker implanted, which is, which is working, 100%. It's really great. And in fact, it doesn't even function most of the time because my pacing with my own heart is like 80%.
Fine.
So, yeah. But what I'm, concerned about in terms of, a cardiologist's recommendation is what I was told was that in addition to the possibility of, clotting with a stent, that also, there can be scar tissue, blah, blah, blah. And as I said, I'm reluctant to do that baby aspirin because I feel I'm highly susceptible to a bleed. So I thought that pycnogenol and the nattokinase, combined, and then, of course, I take a lot of supplements that are antioxidants and whatnot, that would have blood, more blood thinning type of effects. If that kind of covers my bases in terms of, not resuming with a baby aspirin.
It's an interesting thought, but it's an interesting thought to consider that all these supplements would be putting you in a place that would be less risky, and they might. Most people that I know that have taken supplements have done it for many years, and they still had a heart attack through the supplements, and then they adjust the supplements afterwards. But one thing that I have found over the 30 years doing this kind of work is that random supplementation is just that. Random undirected supplementation. I have no idea what its effect is going to be, whether you need it or whether you need to spend the money on it. And so what I do is actually evaluate risk through a bunch of different clinical tests and histories. Your history would suggest you might have some risk, but I don't know what your vascular inflammation looks like right now. I don't know what your lipid profile looks like. I don't know what your omega balance is. And so not knowing those things, I can't recommend any kinds of supplements for you to take because I don't know where you have gaps or excesses.
I see. Okay. And I understand that. And perhaps, the importance to go forward, with, getting that kind of testing and information.
You can get things like the Omega Index from Quest. You can get your B12 and your D3 levels. You can get the levels of many other, chemicals. Like I mentioned, the Cleveland Hearts lab, it looks at myeloperoxidase and LPPLA2, which are chemicals that are elucidated from rancid, inflamed plaque that would be at risk. You can get a clearly AI coronary CT scan reevaluation to see if there's any other plaque anywhere besides the area that was stented. There's a bunch of different things you can do to evaluate your current level of risk and status, antioxidant wise, sticky blood wise, all kinds of things.
Okay. Yes, that's very helpful to know that there are those resources out there. And the other question is there any holistic minded or holistic leaning, or at least someone open-minded cardiologist in Sarasota?
I think she just retired.
Yeah, Chippy.
Yes. And it's very difficult to actually get a conversation with a procedurist because procedurists have limited time to actually talk about anything but the procedure. I've not been thrilled with the approach nutritionally or otherwise lifestyle with any cardiologist in town. They're basically geared towards medication because that is Western medicine. It's prescriptionism.
Right, yeah. And I actually was established with Chippy, had one session, and then she retired. And she is in practice, but not practicing cardiology. So, but I just thought if there was one who at least was more open-minded, as soon as, and I understand their hands are tied because of the practices that they are in terms of, they have to practice Western medicine. But they don't have
to practice a type of delivery that doesn't involve, expanded, nuanced, critical thought.
Right. Yeah. Okay. Well, anyway, but the pycnogenol and the nattokinase, I think those are helpful supplements for heart patients to be on.
I think they have been shown to be very vascular, active, healthy supports. Yes, definitely. But I would get some regular vascular inflammation evaluation to see just where progress is with anybody who has heart disease.
Okay. All right. Very good. Thank you very much. Nice to hear
You're welcome.
your voice. Okay.
You too. Have a great day.
Thanks. You too. Bye.
Bye-bye.
And thank you there, Judy. We're down to about 15 minutes and some change remaining. So give on out the phone number one more time so we can avoid some of you foot draggers on out there. You drive me up the wall. You wait till the last minute. I want to get you on the air to the Healthy Steps Radio Show here on WMNF Tampa. The number to call is 813-239-9663. Again, give us a call and participate in the Healthy Steps Radio Show by dialing 813-239-9663. And I do have Joe on the line. Good morning, Joe.
Good morning, Dr. Harvey.
Good morning.
Good morning. I just want to let you know I love your show, listen every week, and thank you for the valuable service you provide.
Thank you.
So I recently signed up for a Function Health membership online, and they basically do lab work, and then you get some recommendations and so on. And yes. I just got my first round of lab work back, and most everything was in range. However, I was alarmed to see that a bunch of biomarkers for autoimmune health were out of range, tested positive for anti-nuclear antibodies, and pretty much everything else associated with that were, out of range and so on. And I know that it could basically indicate any number of autoimmune conditions, but I'm just wondering, I do have an appointment with my primary in a couple weeks, and obviously this will be at the top of the list, but just wondering what guidance you might have or recommendations or what I can be doing to help myself.
So do you have any markers besides the positive ANA?
I'm sorry, can you repeat that?
do you have any biomarkers that showed up as abnormal besides the positive anti-nuclear antigen?
Yes, the ANA pattern was out of range. It said nuclear homogeneous. The ANA tier out of range.
What was the number on that?
1:80.
Oh, okay.
And then the anti-nuclear antibodies says titer was out of range 1:40.
Okay, good. So whenever you get an antibody to your DNA, it means the DNA is looking abnormal to your body.
Right.
The reason that happens is you get oxidation of the DNA. You get damaged DNA, and oxidative stress, toxins, and inflammation actually induce that kind of change. There's machinery in the body to clean that stuff up, but if you have constant irritation, you're going to have constant degradation. And so you're always going to have this stuff show up. We can actually check your body for the rancid DNA. It's called 8-hydroxydeoxyguanosine. Shows up on my premier intake test called the NutraEval. Levels of 1 to 40 and 1 to 80 of anti-nuclear antigens are minimal and relatively irrelevant in the grand scheme of things. However, they're a signal that you have toxic inflammation in your body, damaging your DNA and creating a scenario where your body's not happy about it.
Okay.
So you have no autoimmune disease, and it's not likely you'll develop one if you make some changes. And some of the changes to make when you see this kind of stuff showing up is to some basic lifestyle changes would be to eliminate every possible processed food, artificial color, artificial flavor, artificial sweetener.
Including stevia.
Stevia is not artificial.
Okay, that's what I thought. That's the only sweetener I use for coffee.
So stevia, allulose is a non-absorbable sugar that has some really interesting properties. In fact, it acts as a GLP-1 agonist, so it acts like Ozempic in your body. It tastes not as sweet as table sugar, but you can use that with some stevia to reduce the amount of stevia, because I think stevia's aftertaste is horrible. But allulose actually beneficially affects your body in the way that Ozempic does. It turns down inflammation. So allulose is a great sugar substitute for you. And that would be another thing you could move into the picture, because you want to reduce inflammation, because what you've got is inflammation. 1 to 80, 1 to 40, those are basically inflammation markers. And so another thing you can eliminate, which bothers a lot of people, is pasteurized dairy.
Okay. Yeah, typically I'm an almond milk and soy milk drinker, but there is some dairy and cheese in my world.
Yeah, so try and move over to the raw cheeses, because the pasteurized has a chemical in it that looks like a fungus byproduct that your body can react to in an immune fashion. And another thing to get rid of is all grains that contain gluten.
Okay. I thought that might be one of the culprits.
Yeah, those basic changes will clean up the body, because gluten in America is sprayed with Roundup. And so you're eating poison whenever you eat it. So you might as well just get it out of the system and then see what happens overall. And other things you can do is to make sure that your omega index is over 5, maybe even over 8, to keep you in an anti-inflammatory state. You can look at that on a test. You can make sure your hemoglobin A1C is below 5.5 and that your uric acid is below 6.5. There's a lot of different things out there you can do to actually work on calming down the processes in the body. They're promoting an anti-nuclear antigen.
Okay, wonderful. Thanks so much for the insight.
You're very welcome. Good luck on that.
Thank you. Bye.
Well, thank you, Joe. And as the doc said, good luck with that. I do have James, Christina, and Mike on the line. So let's go to James in St. Petersburg. Good morning, James.
Hey, Doc, I'll try to make it quick. I listen to you every Monday. I love your opinions on things. Back in 2011, I torn my meniscus and I got surgery done. And for like the past 15 years, I was in pain. And then this Friday, I went to my orthopedic specialist and for the first time decided to get what's that shot called?
Steroids?
Yeah. I know there's another name for it with
prednisone.
Yes. And I was wondering what your opinion was on that. I mean, I got in my knee after the shot. My knee feels like it did before I tore my meniscus.
It feels like what?
Before it did, it feels fine. Like my pain used to be between a 4 and an 8, and now I'm at 0.
Okay, good. So you've had some improvement there. Repeated use of intra-articular injections with steroids actually causes further degradation of the joint. My suggestion would be to find a muscle activation technique specialist and see if the postural balance can be fixed and you can actually take the pressure off that knee. Muscle activation technique, very unique approach.
Muscle activation technique?
Yeah, look that up online. You can find a practitioner in many cities across the country.
All right, thank you. I appreciate it.
You're very welcome.
Bye.
All righty. Thank you there, James. Let's go to Christina, also in St. Pete. Good morning, Christina.
Good morning, and as always, thank you for your amazing show, Dr. Harvey.
You're welcome.
Quick question. I thought about what you were saying in the intro and the different tests for assessing heart disease or future heart disease. My mom's an interesting case because back in 2016, she claims that it was caused from her congestive heart failure, that it was caused from buying some type of facial cleanser that she developed a horrific reaction to, and her blood pressure went straight up. She went to the emergency room, and yes, long story short, they diagnosed her at that time with congestive heart failure. She says that has since gone away. But I don't know. Is that possible? Can congestive heart failure actually be cured? And whether it can or not, wouldn't she be a good candidate for these tests since she had that experience?
So congestive heart failure means the pump isn't working. Lots of things can challenge the pump and prevent it from working well. So if that challenge is removed, the pump can work better again, and medications can improve it too. But I think that anybody deserves if they've had congestive heart failure, I would suggest an annual cardiovascular workup to make sure that the heart pump isn't failing again.
An annual cardiovascular workup.
Similar to what I basically described here. And one thing that they would need to do is an echocardiogram, an ultrasound of the heart to see how it's functioning. I think that everyone who has had heart failure deserves to have regular monitoring because heart failure is another killer. It's just not as frequent as a heart attack, but it is as devastating.
Okay. All right. Thank you. That's very helpful. And have a wonderful day.
Thanks. You too.
Thank you, Christina, and your mother as well. Let's go to Mike in Clearwater. Good morning, Mike.
Hey, doctor. I'm curious. I have a couple cysts growing underneath my arms, each arm, and they're both in the same place, and they're kind of sore. I made a doctor's appointment, but, I went online and looked at it, and, of course, I'm dying from the C word, so I'm just curious what you have to say about this.
So you have painful lumps in your armpits?
Yes.
Okay. That's likely to be something called hidradenitis suppurativa, meaning you have basically pustules inside some sweat glands. They get blocked off and they fill up and they get very tender and painful. And it's probably related to your microbiome, meaning that there's dietary influences that could actually affect this. And not that I'm saying you can cure it by getting rid of dairy or something, but something is promoting like some of the wrong bacterial growth in your system. And you're having inflammatory materials build up in your sweat glands that are really making the bacteria living in your armpit not happy. And so they're reacting and they're all getting together and there's white blood cells in there. And so there's something about what you're doing that's causing this to go on. They can be lanced and drained, but they often come back until you find out why you're causing them.
Okay, I have been doing, these all started once I started drinking this drink called Olipop, which is supposed to be a digestive drink.
Yeah, it is. And what it does...
I drink a lot of it.
It changes.
So.
That Olipop is a prebiotic. It's got good fiber in it, and it actually changes your microbiome. So it may have actually changed it to one that's not good for you. I would look about getting rid of that and seeing if you can get this to clear up.
Yeah, that's it. I mean, looking back, these all started when I started drinking that, and I drank probably 2 or 3 of them a day. So
wow, yeah, that easily could be a source here.
Well, we all like to poop, don't we?
Yes. Try a probiotic.
Like what? What would you suggest?
The one I use is called Probiomax Daily DF for dairy free. From Zymogen, Xymogen. I take one of those about 3 times a week because it's about all I need. It's a really very potent probiotic.
Is there any foods that I could be eating more of right now that wouldn't make a major change in the microbiome?
Well, every food you eat does actually change the microbiome. Some make it better, some make it worse. So you're taking a lot of extra fiber right now. You may just want to actually just stop that and see what happens before you do anything else.
Okay. Yeah. Well, that's an easy fix, but
I do things one at a time. You're very welcome.
Yeah.
Hope this works.
Yeah, I just wanted to say one more thing. I did look online, and it said that what are they called? Our when they pop out now I'm forgetting what they're called, underneath our arms, they're in our neck, they're all over our body, the lymph nodes.
Yes.
So that's what I was concerned about, that they're lymph nodes that are swelling, and there's a bigger problem, of course, when I go online. I'm already putting the nails in my casket when I start reading.
Yeah, usually lymph nodes of cancer are not painful. Lymph nodes of infection are painful, and these sound more like hidradenitis because they're very common. I go for the horse in the room before I go for the zebra since we're in America.
All right. That's some good information. Thanks for your help. I feel a lot better. Thank you.
You're so welcome. Have a great day and good luck with those. Hope they get better.
Okay. All right. Bye.
Bye-bye.
And thank you there, Mike. We're down to the last few seconds and change, so let's go to what you got in emails and goodbyes.
Yes, we're down to the end here. So Robin has sent us another poem. Thank you, Robin. And this was a simple one. Sometimes you have to walk away from all the noise. Find a quiet spot, close your eyes, and just breathe. That is so real. That is so true. And that's what I did this weekend because I was frazzled after watching the onslaught of fascist weirdness coming out of the Oval Office this past week. I was just done. So I got in the car and drove away and went and hung out with birds in a bird paradise. Breathe. Just remember. And Ryan, if you're out there listening, I'm saying it. Breathe. Breath work is the key to all this meditation too. Take time, take a nice slow breath, let it out, and do it 5 more times. You'll be in a completely different place. I want to thank Bill for running the boards today. Thank you, Irene, for really taking all these calls and helping all these people. And thank you for all the calls. You're really brilliant, and I love talking with you all and being able to explore all kinds of interesting health information. See you next week.
Well, and thank you there, Doctor. And I want to thank Irene for answering the phone. She's always great at that. And I want to thank our callers for participating and making this show special as it is. And also mentioned, as the doc had said earlier, about the upcoming pledge drive. That'll be the week of February the 19th through the 26th. So don't dawdle. Again, you've been listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. To everybody out there, stay healthy. Take care. You have been listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. Almost closer than a freckle on your neck is 5 minutes of NPR headline news, followed by the Sustainable Living Show, hosted by the masterly team of Tanya Vidovic and Annie Ellis. Until next Monday at 10 a.m., thank you for supporting and listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa, your community conscious radio station. Stay safe, stay thoughtful.